So let's look at situational judgment. As you know, this is one of the modules or units, shall I say, of what makes up the UCAT test. It's one of the 5 sections. So situational judgment, what's it all about? How, what's it testing? Why? How do we do well in this particular section? This is what I'm going to cover in this particular module now. So ask me the question, why situational judgment? Well, it's quite simple. If you look at what the UCAT consortium talk about, it very much matches into what the Good Medical Practice document talks about, the GDC statements talks about for dental students, and that is situational judgment is about seeing whether you have some very important tenets and qualities that we associate with doctors and dentists. Integrity, all right? What's your integrity like as a person and as a professional? What about your perspective taking in a given situation, especially challenging situations? It's important to test you on that. What about your appreciation of working in team settings and being able to work with people, colleagues, other service providers perhaps, people who you may get on with, you may not get on with, you may have to have a professional relationship. How do you manage those situations? It also talks about resilience. There's a chat about resilience going on here. And I'm not sure if some of you will know the meaning of that word, or especially given the context of medicine and dentistry. In the context, what we mean by resilience is given a difficult situation, how you apply yourself, how you're able to conduct yourself, how you're able to apply the ethics, the beliefs, the morals, and the code of conduct in that given situation, even though the situation is quite difficult and challenging perhaps. Kind of related to that is adaptability, how you adapt to situations, whether they're strenuous, whether they're not everyday situations, whether they're kind of difficult situations. How do you adapt? All right, do you have that ability to do that very thing? Your perspectives and your ability to conduct ethically, morally, and be able to face off dilemmas looking at these things. What about conflict as well? The conflict resolution situations. Can you manage conflicts? Can you resolve them? Can you solve them? And what I said before as well, it's important here in that the situational judgment is a very important component of the UCAT, which actually helps you prepare well for medical and dental school interviews. So you may get a scenario where they want you to decide if something is appropriate or inappropriate. Well, it would be lovely if it was just those 2 options. What UCAT do is give you 4 options. So they give you something is very appropriate to do and something is appropriate to do. So that's on the appropriate side. On the inappropriate side, they'll say something is kind of inappropriate but not awful, i.e. it's slightly inappropriate. And then they'll say something is very inappropriate. So there, in the inappropriate side, you've got 2 options as well. So basically, you've got 4 possible options, right, to decide. First of all, is it appropriate or inappropriate, right? And that's how I think these questions. Is it appropriate or is it inappropriate? If I decide it's inappropriate, then I do the next thing, which is it very inappropriate or slightly inappropriate? And I would do the same trick, really, same thing for appropriateness. So if it's appropriate, is it really appropriate or slightly appropriate? That's something you can differentiate later. So that's how my elimination theory comes into play here as well. That's a really good strategy to adopt here. And then, of course, you get questions which are about importance, right? So in a similar way to what I've described before, you get your scenario, and then you have to decide if that whatever's being asked in that situation is important or not important, okay? So if you decide something isn't important, then you decide if something is completely unimportant or slightly unimportant, right? And then in a similar way, if something is important, you can then go on and decide if it's really important or slightly important. So that's how I would do it. First of all, decide important or not important. That's phase 1. Phase 2 will be to decide if it's like, depending on which way you've gone. So let's say you've gone towards the not important, you'll now decide whether it's really unimportant versus slightly unimportant. That's how the importance questions are working. So here, let me just expand on a few tips I'm about to give you, and I think they'll be important in making you think in the right way so that you arrive at the right answers, really. One thing I tell my students is that, look, it's important to do preparation. It's important to read things beforehand. So, a good tip would be to read about the Good Medical Practice document or the GDC statements on being a good dentist, right? Because these things talk about, what is acceptable and what isn't acceptable, what is ethically right and not ethically right. So these things help, I feel, in answering this particular section of the UCAT. What I don't find is necessary is not having specific medical knowledge about procedures and tests and management and diagnosis and things like that. Specific medical knowledge isn't required. What is required is your kind of appreciation and understanding of some key concepts of like professionalism, honesty, and ethical issues and so forth. Don't overthink it. Don't spend too much time on scenarios. Once you've read it, maybe read it again to understand it and then answer. Don't overthink it. Sometimes that can give wrong answers because people look into it too much. Generally, it's what comes to your mind first seems to work better. All right? The answers, right, is again, when it comes to say, you've got the scenario and the questions, right? And I said to you before, there could be 2, 3, 4, 5 and questions on each STEM question. Now, it's very important that when you've answered one question, the first one, it's important to realize the answer to the second one is not related to the first one. They're not linked. So just because you've said, for example, the answer to the first question is very important, that doesn't mean that answer to the second or the third or the fourth question can't be very important as well. You can have repeat options, right? You may have some options that you don't use at all. So just bear that in mind. They are independent of each other. Also answer based on what you've read in front of you, based on the scenario, as opposed to any background knowledge of a similar situation that you might have come across at work. And don't let things like that sway your thinking, right? You'll get mixed up. Just purely based on what's in front of you. That's the kind of answer you need to look for. Okay, so there is an ongoing debate about full marks versus partial marks, and that's to do with kind of answers that a certain cohort of students might feel is the right answer, but UCAT have a different view perhaps, and but they may give some marks for an answer that's been selected by a lot of students because there's actually some truth in it or some sway there. So don't worry too much about that. It's very rare you come across these situations nowadays with the way how vigilant UCAT are in selecting their questions. So I've not come across this situation for a while. Read scenarios carefully. The number of times students just rush, they don't think, they don't read, and then they try to answer the question, and they do get it wrong as a result. I've already told you not to overthink, all right? And so, respond quickly. I think first impressions count here, and those tend to be the right answers. And by all means, have a look at some of the official questions that UCAT publish on their consortium website. So do have a look at that. One of the key sections that you'll come across when you read these documents is knowledge, skills, and performance. So to kind of understand what this is talking about, to grasp what it's on about, it's quite simple, really. What you want to do is have an overarching view that the care of your patient is your first concern, and that really supersedes the need for yourself and colleagues even. So we look after our patient, given safe parameters, of course. We don't put ourselves in danger to look after our patient, right? So for example, patients come to you severely unwell with COVID-19. Doesn't mean you go and see the patient without PPE, without the due preparations and safety issues that you need to observe. So within safe limits, you make the care of your patient your first concern. The second principle that the knowledge, skills and performance section talks about is being up to date. So you need to appreciate that as doctors and dentists, we need to learn throughout our lives. It's lifelong learning, it never stops. Otherwise, your knowledge and your skills become redundant, and you might end up doing wrong things, frankly. So it's about being up to date. It's about being evidence-based and making sure you're always dispensing the right treatment, the right care, the right surgery, perhaps. And also, in doing that, you need to incorporate competence, and that is recognizing and working within your level of competence. So do not put your patient at danger, or yourself for that matter, at danger by doing something that you're not qualified to do, by doing something that you've not trained to do, by doing something that puts your patients and yourself at risk. So I've touched on this slide already, haven't I? And that is that make the care of your patient your first concern. Everything that we do, we say, we enact, it needs to be for the benefit of our patients in that situation. And that tends to supersede the need of colleagues, and that tends to supersede the need of you might have. So your patient comes first. Now, as I said before, it's important to realize that what we're not doing is putting ourselves at risk. So I'm not going to jump off a cliff to help a patient at the bottom, right, and put myself at danger. I'll get there in due time in a safe way to help my patient. My patient's collapsed in a pool of water and I need to defibrillate them to get the heart going. Well, I'm not going to do that whilst they're in that pool of water, because I might end up electrocuting myself. So you need to make that situation safe before you can try and save your patient. So these are the kind of things you need to think about, really, about making care of your patient the first concern.